I get asked this question all the time. One of the points of these videos is not really to bring patients into me, because I'm in the East Midlands and obviously this is designed for everybody to get information. We have loads and loads of fantastic surgeons out there working in the NHS and the private sector. The training for ophthalmology is really quite stringent, and we are very, very focused on looking at people's outcomes, so your surgeon will be safe. And so there are lots of fantastic guys out there. Who should you pick? You know, it's really about hearing from relatives and friends and recommendations. Look at the profile and the website, see what they do. There's no problem with asking how many cataracts do you do. Some people have different specialities, and I'm a cataract and refractive specialist, but I've also got glaucoma as another hat on. A lot of people have these specialities, so they may only do a limited number of cataracts. And it's entirely reasonable to ask the question, how many cataracts do you do a year? There is no minimum number though, so it's very hard to judge. But you know, it's all about personal recommendation, and cataract surgery is a pretty safe and straightforward thing to have done. And if you've got a consultant ophthalmologist who's working in the private sector or the NHS, then please rest assured they are very, very heavily vetted, and so they will be very, very good, so you don't need to worry about that. Personal recommendation makes sense. Look at their profiles, see what they've done, see if they're actively involved in things. But again, you can get very good surgeons who are not actively involved. It's nice to see somebody who has a special interest in cataract and refractive surgery, but not necessarily at all. I think that I've got some fantastic colleagues out there, and they will look after you very, very well. Personal recommendations are always helpful. Look at reviews as well. Reviews may be more about bedside manner and stuff, but that's not a bad thing. We've all got to look after patients, we've all got to be nice to patients, and I have no problem with people looking at things about bedside manner. But you know, there are lots of fantastic surgeons out there, and I don't think you need to worry about picking one, but ask questions about complication rates, ask questions about how many cataracts they do. It's entirely reasonable. If you were going to get somebody to come and change your boiler, then it's entirely reasonable to say, well, have you done this before? How many do you do a year? And you know, have they gone horribly wrong recently? So you know, these are your eyes, and so it's important. So ask these questions, and the surgeons will be happy to answer them because they're all professionals. But rest assured, it's a pretty safe thing to have done, so I'm sure you'll be very well looked after.